Hi there, I'm Jenna, CEO and co-founder of PocketRN, a virtual nursing care provider, coming at you with a 2-for-1 tip for the Health Futures podcast with Bob Roth. What do you think of when you think of telehealth? Well, most people think about it as an option for once you've gotten sick to get in touch with a doctor right away to get a prescription or get a little bit of advice, fast and easy, and move on with your day. And while there is that reactive side of telehealth, on the podcast, we talk about a little bit of a different approach, a much more proactive approach that we take in partnership with organizations like Cypress Home Care. And at PocketRN, our approach is to give patients and their family members and their caregivers a virtual nurse for life. So this is a dedicated nurse who gets to know you, builds trust in a relationship with you, and follows you as a care partner throughout your entire journey. That includes following you through transitions of care to doctor's appointments, providing clinical advice, coaching, education, monitoring for changes in condition, working with your professional caregivers to execute your care plan. And yes, of course, they're also there at 11 p.m. on a Friday night if you have a burning question. And all of this is with the goal of keeping you healthy at home and getting you the support and care that you need. Now, let me give you tip number 2, which is just an example of how our nurses execute on this every day. So we work with a lot of patients who have heart failure. And if you're a son or daughter caring for mom or dad who has a new heart failure diagnosis, you know that heart failure is one of the leading reasons that people end up back in the hospital. And so there's a lot you do on a daily basis. You have to monitor their weight, make sure they're on a low sodium diet. And so one thing you might do to try and give them a healthy option for dinner is pick them up a burrito at Chipotle on the way home. Little do you know, that might be worse than getting them a pizza or a Whopper. When you thought you were getting a healthy option, really you were getting a burrito that has at least 2,000 milligrams of sodium in it. So these are just some of the little tips and tricks that our nurses help our patients and their family members with on a daily basis that you wouldn't know if this is your first time caring for a loved one or if you're not a clinician yourself. So thanks so much for tuning in. Looking forward to sharing more about virtual nursing, about our partnership with Navan and Cypress for Access in Arizona, and more. Thanks so much.